We've seen where people have died from this. We've seen where even younger people have died from this. And so this, on many levels, was really heart-wrenching.
It's just hard to live through this. It's very challenging, or it's not normal, and we want to deliver the best care possible.
This is the biggest medical crisis that this hospital has ever faced. And we knew COVID-19 was coming. Governor DeWine asked the hospital to be ready to surge to 300% of its normal census.
This was going to take more than just a single hospital to take care of the county and the surrounding areas. We collaborated with the schools, with some of the post-acute care facilities.
And we knew we needed to take that leadership role to be ready to deal with whatever the COVID-19 epidemic brought to us.
As COVID, panned out, we didn't see the surge levels that we were anticipating to see in the acute care setting. But what we did see was that we were having outbreaks in our extended care facilities.
Geauga Hospital was able to step up and respond and do what was necessary to take care of our community.
It was like, without exaggeration, a tidal wave of a virus that not only hit your patients that you care for, but hit your staff.
When we had 2 residents that passed overnight, and we didn't have enough staff to sit by them. I remember going into the administrator's office and asking for help, and within the next day I had university there. Simple things to hold their hand. Nobody should have to die alone like that.
We quickly responded and worked with their leadership. We used our system resources. They quickly developed a playbook, and they were on the location for days.
They gave us order, they gave us structure, they gave us a plan to begin to execute. They really helped us to be able to think right.
We ended up very quickly actually having some of our staff go over to Briar Hill to help support them.
I recall giving them a list of things that I needed just to provide the basic care for our residents. And by that evening, I had those things. And it just continued from there.
We were able to equip them with advanced technology to be able to monitor their respirations and some of their other vitals. What it helped do was it helped almost make them into a remote hospital because they had the equipment and the monitoring and the resources and the expertise. They were able to adequately and safely care for patients that had COVID virus in their own facility.
I could easily say this would have been a much different story if university hospitals didn't help out to the extent that they did.
I think that ability to extend and to listen and to share your expertise just made a world of difference for everybody.
And never seen the community and the hospital pull together like this to combat any disease process, and it's been very heartwarming to see.
When we talk about patients first, this is one of the finest examples. This goes sort of way beyond just day-to-day expectations of what a doctor or nurse or environmental service person we expect from them. This is much more than that.
We had a lot of nurses that did some really amazing things.
They put the interests of others above the interests of themselves. They did good things for good people's sake.
University Hospitals is truly dedicated to the community and to ensuring that the community has what they need.
Focused on both patient care and quality and doing what's right for people.
They changed the game on the battle of COVID.
I am so proud of the work that the hospital did, the patient care, the compassion, the dedication, the bravery. I want all of the people who are employed here, who work here at UH Geauga Medical Center, to understand the debt of gratitude that the community has for them for the work that they've done.